Welcome everyone to our third presentation in our All About Alzheimer's monthly series, where we hope to bring you, useful information that you can take back with you to your respite and support groups, and or those of you who might be caring for family members or friends in your social support system. It's a pleasure to be here with all of you, some of you again today. It's great to see some of you back. For those of you I haven't met, my name is Joan Asseff, and I'm a licensed clinical social worker here in the state of Texas. And as some of you know, I've spent most of my career, if not all of it really, working with older adults in a wide array of settings, including skilled nursing, hospice, home health, psychiatric care, and private clinical practice. So this is my love and passion, really, this area of practice. I now teach clinical social work at the Steve Hicks School of Social Work at UT Austin, a position I love and really enjoy teaching up and coming social workers. I've worked extensively with individuals and their caregivers going through the extreme challenges of Alzheimer's disease and other dementias. And I want to recognize, as always, the selfless and painstaking work that you do in various ways to support those impacted by this very difficult disease. And I'm honored to be here with you and humbled today, and look forward to collective problem solving as we think about ways to support folks going through these difficult times related to this disease process. So as you know, we're recording this session, but we really encourage questions and discussion at the end of the presentation today. And we look forward to that. So with that, we'll get started. I'm not going to spend too much time because a lot of you are familiar with Alzheimer's Texas, but we want to make sure that we have a quick note. As many of you are aware, Alzheimer's Texas is an independent local nonprofit that used to be known as the Alzheimer's Association, Capital of Texas chapter. They have been a privately funded voluntary health organization since 1982, which is quite a while now, serving Central Texans with Alzheimer's disease and their caregivers. About 3 or 4 years ago, Alzheimer's Texas broke away to form their own nonprofit and decided to focus 100% of their funds and efforts here in Central Texas. However, as you know, as evidenced by today, Alzheimer's Texas maintains the same level of commitment, providing support, education, and advocacy for those affected by Alzheimer's in our community. I always tell my gerontology-focused students that Alzheimer's and other dementias are an increasingly urgent public health issue and one of the most significant health crises of our lifetime, especially as baby boomers are aging and the life expectancy is increasing. 1 in 9 people over 65 and nearly 50% of those over 85 have a form of dementia. It is simply staggering, those figures. Many people will live with these diseases for longer, creating unprecedented demands on our society and on our healthcare system. So this is why conversations like the one we're having today are so important as we mutually support one another. So with that, we'll think about our learning objectives for today. We want to identify signs and symptoms that might precipitate transition out of a community-based respite care program. And we want to normalize the experience of transitioning out of a respite care group, including possible grief and loss for both caregivers and those living with dementia. We want to better understand practical supportive methods for navigating this transition and for navigating others as well. And we want to think about and share ways that we are supporting ourselves and others who need to transition out of community-based respite care. So we hope to touch on all of these areas of learning today. All right, so I want to start out by saying that there are many practical reasons why a person living with dementia or their caregiver might want to transition out of a respite care group. These include moving to a different part of town or a new city, a change in the caregiver's personal schedule, or the availability of alternative respite care through a friend or family member or some other service. Those types of transition out of a respite care group, while still emotional and possibly very sad and difficult, are logical and make sense for folks. They can still be difficult, as I mentioned, on both the caregiver and the person living with dementia because they can still be associated with grief and loss and confusion about what is happening on the part of the person living with dementia. While these scenarios can be very challenging, we are focusing today on scenarios where attending a respite care group is no longer appropriate. It's just not an appropriate form of respite care for the person living with dementia. So these are just some of the signs and symptoms that might tell respite team members and caregivers that a transition out of a respite group might be appropriate. These signs and symptoms are similar to those often associated with the middle stages of Alzheimer's disease or other dementias. Um, while some of these are related to a significant health decline or event. So kind of fall into those two categories. I want to be clear that these signs and symptoms alone don't necessarily mean that it's time for a person living with dementia to transition to an alternative form of respite care. The need for transitioning out of the respite care group usually occurs when these signs and symptoms do not resolve with medical intervention, or the person is unable to recover enough cognitively, mentally, or physically to return to the group in some meaningful way. We know some individuals will be able to return to the respite group after experiencing a health change, though their participation ability or level might change, and that's understandable. However, sometimes the changes are so significant that this type or method of respite care is no longer appropriate. I won't read all of these to you, but I want to note that the mood or behavioral changes are often the most challenging signs and symptoms associated with transitioning out of a respite group. This is because some caregivers or family members might not recognize these symptoms are hindering both their loved ones' participation and benefit within the group and other group members who are being adversely impacted by the mood or behavioral issues. There are also times when a caregiver might be dissatisfied with their experience of the respite group. That does happen, and I'm sure you might have experienced this in your work. This could be for many reasons, such as the person with dementia is no longer actively engaging in the group, and that might lead to their caregiver being generally dissatisfied with their overall experience, in the group or with the group. Later in the presentation, I will share how ongoing communication with caregivers and group members can help everyone be more aware of these signs and symptoms and others that aren't listed here, which helps everyone know when it's time to make a change or start talking about making a change. And I welcome you to share some of the signs and symptoms you have seen in your work. And we can do that at the end of the presentation. We really welcome that because I know there's others that might not be represented here. So one way we can support persons with dementia and their caregivers during the transition out of a respite care group is to normalize the care transition in general. We can talk about transitions in the beginning of our work with group members and their caregivers and throughout their participation in the group, an ongoing communication with caregivers. We can even share statistics like these, as you see here, showing 89.2% of one sample of older adults with dementia had one or more hospital stays, and 54.9% had at least one stay in a skilled nursing facility in the past year. Additionally, in a study involving Medicare beneficiaries living with Alzheimer's disease, 77% have 3 or more additional chronic conditions, and 95% have at least one additional chronic condition. These chronic conditions inevitably lead to changes in functioning and to care transitions, some of them temporary and some of them long-term. We know that persons with dementia have greater odds of having potentially avoidable hospitalizations for their chronic conditions, creating more transitions. In other words, one of the best ways we can ease transition out of a respite care group is to routinely and repeatedly recognize and validate transition as part of the dementia journey, rather than something we should be afraid of or something that we don't expect to happen. It will happen, hands down, and we know this for most people. And a community based respite care group is not an appropriate respite plan for all stages of Alzheimer's disease or other dementias. We will talk about ways we can normalize this eventual transition from the beginning of our relationship with respite group members and their caregivers, and how to support them through the transition. One of the most important steps in supporting respite group members and their caregivers through their transition out of a respite group is to validate their experiences and feelings. As I mentioned, we want to help them conceptualize this and all care transitions for persons living with dementia, not as events, but as part of a continuum in their dementia care journey. Because again, these are to be expected. We also want to validate the transition by recognizing the potential experiences of grief, loss, and chronic stress for both the person living with dementia and their caregiver. While we might know that transitioning out of the respite group is the best step for the person living with dementia, we also know that they and their caregiver will likely feel some level of loss. That really is understandable. These experiences can include the loss of friendship, socialization, mutual aid, and a sense of community around this very difficult disease process. It's important for us in the helping role to acknowledge and validate these feelings. We know that many people experience disenfranchised grief or unrecognized grief during a transition like this. Friends and neighbors might not understand the grief and increase in chronic stress a caregiver is experiencing because their loved one can no longer attend the respite care group. But the grief is real, and it's really important to recognize. Caregivers might also experience heightened anticipatory grief, meaning the sense of losing their loved one prior to their actual death or passing. We should not underestimate the contribution this kind of transition can make to the risk for caregiver burnout as well. On the next slide, I have a quick reminder of the symptoms for caregiver burnout that we should be looking for during this kind of transition. Our hope is that we will be able to make some helpful referrals for caregivers going through this transition and help them access the support they need. Finally, it's important to think about ways you can provide time and space to hear about the experiences of caregivers and group members facing the transition out of the respite care group. If you don't have time during respite care programming to have these conversations, which is understandable, then maybe you or a volunteer could make a phone call to a caregiver later in the week to check in, talk with them about next steps, and make sure they have resources to seek alternative respite care. So here is just a quick slide to remind us of the signs and symptoms of caregiver burnout. I'm sure none of these come as a surprise to those of you who care for those with dementia in various capacities. If you are a caregiver for someone with dementia, it might be helpful to occasionally take a look at this list and ask yourself, how many of these symptoms are you regularly experiencing and how often? If you are someone who provides supportive services for caregivers, you can provide this list to those you were supporting and check in with them to see if they are struggling with any of these. So I just wanted to provide this as a reminder and as a resource as you're supporting those who are transitioning out of respite care. And then this is just a quick snapshot to remind us all that caregivers are really struggling during COVID. I know we know that, but this gives us some statistics to really help it be very clear to all of us doing this work. These figures are staggering, but not completely surprising, especially to those of us who support people with dementia and their caregivers. As we talk with group members and caregivers about transitioning out of respite care or the respite care group, we want to be mindful of the high stress levels they are likely experiencing during this difficult time. These risk factors make it even more important that we create a person-centered supportive approach to transitioning folks out of a respite care group. So with that, let's talk about some evidence-based strategies for effective care transitions. So even now, there is limited research on supporting individuals with dementia and their caregivers through care transitions. While there has been more recent research on supporting patients without dementia and people with dementia in the earlier stages through these care transitions, there's limited research on how to best do this for folks in the middle and later stages of dementia. If it feels like we have little guidance in this area, it's because we really don't have much guidance. So I want to emphasize that. That being said, there are some strategies we can extrapolate from the literature on how to facilitate effective transitions in care, such as supporting an individual and their caregiver through a process of leaving a respite care group. That is really a care transition if we examine it closely. I will touch on each one of these strategies and provide a more in-depth description. Oh, let me go back there. All right. So first, from day one, we want to involve the person living with dementia and the caregiver in establishing a respite plan of care, including goals for their respite care. We know that the best outcomes for care transitions, and this is what the literature shows us, are associated with a person-centered, coordinated, responsive, and tailored approach. Developing a plan of care that can be periodically reviewed with the group member and their caregiver is an effective way to provide this person-centered, tailored approach. Through this plan of care, specific goals can be developed and periodically reviewed with both the group member and the caregiver. Having set goals can help all of those involved in the respite team know how or know when those goals are not being met or when they need to be revisited. They also provide respite group leaders and members and caregivers with a common understanding and language to use when they need to discuss changes in a group member's participation or functioning within the group. If one does not already exist, I recommend considering adding the transition discussion, right? This likelihood of transitioning out of the group to your respite group intake, monitoring, and discharge processes. Again, adding this point of assessment to your routine processes helps normalize this transition and prompts caregivers to be proactive in planning for it. I've provided a link here to the Center for Disease Control's template for creating a care plan. And this is a useful tool for creating an individual care plan if someone is living at home, but also if you're trying to develop a respite group template, care plan template for your group. If your group doesn't have a respite plan of care template, there's a lot of good information on this website about how to develop plans of care. I know your groups are extremely busy and primarily run by volunteers. These plans of care do not need to be lengthy, but they can serve as touch points for open dialogue and monitoring of how everyone in their partnership is doing at any given time. So it can be a really useful tool. Let's see, and if your program, before I move on to this slide, I just want to add, if your program does not use or have plans of care for your group, I really do recommend that you consider taking that step. There's a lot of good resources listed at the end of this presentation as well that could help you do that. All right, so we also want to prepare and educate persons living with dementia and their caregivers about common transitions, including the transition out of the respite care group. As I mentioned, this preparation should occur before, during, and after transitions as part of an overall plan of care. To the extent that you have time and are able, respite group leaders and volunteers can provide literature, like the literature that's available at the end of this presentation, and tools that normalize and educate individuals and caregivers on the various types of transitions and levels of care they will likely experience. We should never assume that caregivers will recognize when it's time to transition their loved one to an alternative form of respite care, or that they will be knowledgeable about the many transitions associated with dementia care. As I mentioned, there are so many stressors and strains, and I know you know that, on caregivers, and this information might not be available to them or simply wasn't mentioned to them in other care settings. Respite group leaders and volunteers can utilize routine check-ins, either formally or informally, to evaluate respite plans of care, goals of respite care that the family has and the person with dementia, if they're able to express those, and any potential need for an alternative form of respite care. So it's an ongoing conversation. During these check-ins, supportive questions can be asked, such as, do you think this group is still meeting your and your loved one's respite care needs, right? That simple check-in question can really facilitate a dialogue. And this dialogue is really important because it's a much better outcome or a much better strategy than waiting until the crisis point when the respite group leader feels kind of overwhelmed potentially with having that conversation because there hasn't been a prior conversation. Providing timely communication about concerns, challenges, successes, of course, and questions maintains an open discussion and will hopefully build caregiver awareness about when a transition out of the respite group is appropriate or needed. Here is just one figure that could help a caregiver conceptualize and normalize for themselves the many care transitions they might experience. While this particular figure does not list respite care, I tried to find one that did, but I wasn't able to find one. We know that respite care is an integral part of a person's ability to return home and to stay home for any period of time. Using a figure like this, a respite group leader or volunteer could talk about the ways that any one of these transitions could make participation in the respite group less appropriate, either on a short-term or long-term basis. These types of resources and materials can help caregivers better understand these transitions as part of a normative dementia journey, again, rather than a crisis event. Though we know they're very stressful, and I don't want to downplay that at all. We know that ultimately these transitions do cause a lot of strain and hardship for caregivers. Again, in the resource section of this presentation, you will find some helpful articles that could be great resources to share with caregivers to help them learn more about these transitions and to expect these within their dementia care journey. Research shows that one of the most important steps, the essential step really, in providing folks or supporting folks through a care transition like this is to provide a person-centered approach. A person-centered approach to care transitions considers the needs, preferences, values, cultural traditions, family system, and other factors identified by the person with dementia and their caregiver. Sadly, even now, some clinicians and healthcare providers are not trained in this approach, meaning many caregivers and people living with dementia rarely have conversations that are focused on their feelings and needs during a transition. They just might not get that kind of interaction or be asked those kinds of questions. This is why it's even more important that those of us in helping roles utilize this approach, especially during difficult conversations about transitions. And finally, creating a strong interprofessional collaborative network is an essential part of empowering persons living with dementia and their caregivers, especially during difficult transitions, such as leaving a respite care group. It can be extremely supportive to have resources identified and prepared to share with caregivers as you engage in a discussion about their loved one potentially transferring out of your group or program. While we can't formally endorse or recommend these services, we can provide those community resources and information that gives caregivers a place to start looking for alternative forms of respite care or other resources. It can give them increased emotional or mental health support, which we know is essential, and provide other vital resources that might lessen the stress associated with this transition. Providing these resources is also part of the person-centered approach that I just talked about, in that we are demonstrating ongoing care and concern in the transition process, rather than simply notifying someone that the respite care group is no longer appropriate for their loved one. Another important step is to develop a process for following up with the caregiver who is transitioning out of the respite group. Some of you might already formally or informally do this. This process of following up demonstrates ongoing support for the caregiver and tunes you into any barriers they are experiencing in this transition. For example, if they have reached out to one resource but didn't hear back from that agency, then you could direct them to a resource you know is more likely to get back with them, such as the local area agency on aging, which is really equipped and very responsive in terms of getting back to caregivers. While we know most respite groups are not staffed to conduct full case management, and I really don't want to imply that at all, we know that conducting 1 to 2 follow-up calls or points of outreach can make a significant difference in positive outcomes during this transition. If you determine that the caregiver's case management or support needs are ongoing and more complex than you can provide, which is totally understandable, you're not set up to provide complex case management services, then you could gently set that boundary with the caregiver and recommend that they get in touch with agencies that are really designed to provide that caregiver support. But the overall goal is to provide a supportive, person-centered transition that connects the caregiver to community resources rather than an abrupt cessation of services. If you are a person who wants to read as much as you possibly can about evidence-based care transitions, these are 2 fairly current and comprehensive articles that cover some of the nursing, social work, and other helping professions approaches to supporting individuals and caregivers through these transitions. They are very comprehensive studies, and so I really recommend these articles if you want to take a deep dive into this information, and they're included at the end of the presentation as well. The information I shared today, though, does synthesize the best practices that are highlighted in these articles. So if you don't have time, please know that the information in this PowerPoint does capture the best practices there. So at this point, we want to invite all of you to ask questions, share experiences, and/or let us know about ways you have supported folks transitioning out of a respite care group. I know that it can be a challenging process for everyone involved, and we hope we wish that there was a way for this form of respite care to be appropriate throughout the dementia journey. And we know for most people, the transition out of a group will eventually occur and will be the most appropriate step. So it's important for us to have these supportive strategies developed. All right, with that, I'll open up the floor.